Dear friends, it's really a great pleasure and honor indeed for me to be here on the platform of a very important, iconic molecule of the century, ARNI, in heart failure. Every one of you know that India is the world capital of hypertension, coronary artery disease, heart failure, stroke, and atrial fibrillation. But in the COVID era, we see a surge of heart failure. If you ask me, the prevalence of heart failure is rising very steeply, especially after the age of 55. Trivandrum heart study, if you see the data, the mortality is becoming almost tune of 50% in 5 years. So time has come, we should think of the best molecule in the heart failure. I'm sure you are all aware of all the 4 pillars of the heart failure. Number 1 is ARNI. Number 2 is SGLT2 inhibitor. Number 3 is beta blocker. And number 4 is MRA. These 4 pillars are the robust pillars to reduce the morbidity and mortality. When I talk of mortality, means cardiovascular death, all-cause mortality, and sudden cardiac death. When I talk of morbidity, means hospitalization because of heart failure, worsening of heart failure, and recurrence of heart failure, all are reduced. If we take ARNI into examples, the best way to remember the power and promise of ARNI is by 5 P's. And what are these 5 P's? Paradigm study, prove study, pioneer study, paramount study, and similarly there is one more study which starts with the P. 5 P's are very powerful to show a reversal of cardiac remodeling, a very powerful potential of ARNI, and the rise of NT-proBNP, which is because of atrial and ventricular remodeling and increased filling pressures, which we check by echo by reduction in the E by E prime ratio, we can see only by ARNI. I must tell you, ladies and gentlemen, today with a great deal of confidence, 2 molecules are very powerful in the years to come, especially in 2023 will be the year of heart failure management. Number 1 molecule is ARNI. Number 1 molecule is ARNI. Number 1 molecule is ARNI. Number 2 molecule is SGLT2 inhibitor. Number 2 molecule is SGLT2 inhibitor, and number 2 molecule is SGLT2 inhibitor. They are the most robust data on SGLT2 inhibitor also, because it has multiple metabolic benefits. It is also an osmotic diuretic. It also reverses cardio remodeling. It reverses atrial remodeling, ventricular remodeling, and vascular remodeling, and reduces the filling pressures. The contraindications of these 2 drugs are very simple. ARNI, we don't give it the patients who have got grade 4 or grade 5 CKD when there is a hyperkalemia. Otherwise, there are hardly any contraindications. Only if a person is not able to tolerate and they get a hypotension, but we can go from 25 milligram up to 200 milligrams BD with ARNI. Now, what is the beneficial effect of SGLT2 inhibitors over ARNI? SGLT2 inhibitors are given as a single dose, 10 milligram OD, number 1. Number 2, no dose titration required. Number 3, no hypotension. And number 4, which is very powerful, it is an osmotic diuretic. So the need of diuretics is also reduced. And it can be used in diabetics or non-diabetics, hypertensives or not hypertensives, congestion or no congestion, atrial fibrillation or no atrial fibrillation. So ladies and gentlemen, to conclude, I must say that these two molecules are iconic molecules of the century. ARNI is just 7-year-old molecule, while SGLT2 inhibitor is 10 to 11-year-old molecule. Dapagliflozin 11-year-old, empagliflozin 8-year-old, and canagliflozin 9-year-old. I salute to these molecules as a revolution in the management of heart failure in the years to come. And our next book is coming by the name of and the title of Advances and Revolutions in the Heart Failure. And these two molecules will be highlighted in great details. Thank you very much for giving me this opportunity.